This medication is used to treat the swelling problems caused by a certain immune disease passed down through families, known as hereditary angioedema, HAE. HAE is caused by low levels or improper function of a natural substance produced by the body, called C1 esterase inhibitor. Symptoms of HAE can include rapid swelling of the hands, feet, limbs, face, tongue, or throat, as well as swelling of the intestinal tract, which may cause symptoms such as abdominal cramps, diarrhea, or vomiting. Attacks of swelling may occur without reason, but can also be triggered by anxiety, stress, sickness, and surgery in some people. This medication works by increasing the level of C1 esterase inhibitor to help treat attacks of sudden swelling due to hereditary angioedema. The recommended dosage and timing for taking this medication should be determined by a healthcare professional. Before using Ruconest Vial, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection into a vein at the first signs of an HAE attack, as directed by your doctor. The dosage is based on weight and your medical condition, and you should not use more than 4,200 international units per dose or more than 2 doses in a 24-hour period. If you are using Ruconest Vial at home, it's important to learn all preparation and usage instructions from your healthcare professional. The solution is normally clear and colorless, but make sure to check for any particles or discoloration before using it. If you have refrigerated the medication and the solution used to mix it, bring both to room temperature before combining. And remember to learn how to store and discard medical supplies safely. After giving yourself a dose of Ruconest Vial, seek medical help immediately for follow-up treatment. And don't forget to inform your doctor if your condition does not improve or worsens. If you experience headaches that persist or worsen, it's important to notify your doctor or pharmacist. Remember, this medication has been prescribed to you because the benefits outweigh the risks of potential side effects. However, it's important to be aware that this medication may increase the risk for blood clots, especially if you have a history of blood clots, heart disease, or if you are immobile for long periods of time. If you experience symptoms such as shortness of breath, chest pain, sudden headaches, weakness on one side of the body, or severe allergic reactions such as rash or difficulty breathing, seek medical help immediately. And if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before starting Ruconest Vial, make sure to inform your doctor or pharmacist if you have any allergies, especially to rabbits or rabbit-based products. This medication may contain inactive ingredients that could cause allergic reactions. Also, share your medical history, especially if you have a history of blood clots. If you are planning to travel, consult your doctor to ensure you have an adequate supply of this medication. And before undergoing any surgery, inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use Ruconest Vial if it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is not known if the drug passes into breast milk. It's important to be aware of potential drug interactions when taking Ruconest Vial. This can affect how the medication works and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Ruconest Vial and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication should only be used by the person for whom it was prescribed. Do not share it with others. Ruconest Vial is used to treat sudden attacks of hereditary angioedema, HAE, in adults and adolescents. It helps to relieve symptoms such as swelling, abdominal pain, and difficulty breathing. The dosage of Ruconest Vial is based on your medical condition and response to treatment. It is usually given as a single dose, and the optimal timing for taking it is at the onset of HAE symptoms. It is important to follow your healthcare provider's instructions for the correct dosage and timing of Ruconest Vial. When you have Ruconest Vial, it's important to store the unmixed vial in the original carton in the refrigerator or at room temperature away from light. Make sure not to freeze it. Once you mix the medication, use it immediately or within the time period indicated in the product instructions. If you have any unused portion, make sure to discard it. Keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you have any questions about how to dispose of the medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.